Now, as far as denture wearers, we talked about their options, right? Now, what about the people that have really bad gums, really bad teeth, and you can't save those teeth? What's the dental implant process to give those people their teeth back in your office?
So these are the patients that have a full mouth of failing teeth, right?
Okay.
And they know that they have problems and they need something done, but they do not want to go to a denture. And nowadays, we're lucky enough we don't have to. So what can we do? We do a thorough exam and we tell them, hey, we're going to end up losing all their teeth. A lot of these people already know this. By
So
the way.
The general dentist already told them
That's
that
correct.
we
That's
can't
correct.
save your teeth.
And in fact, sometimes they actually don't even seek out help anymore because they think that, oh my gosh, there's nothing that can be done. They told me I need all my teeth out and I don't want a denture. Well, that's not true now anymore. Nowadays, we have the technology and advances. We can take out all the teeth and place dental implants and give them back new teeth.
In the same day?
Same procedure, same day, within 2 hours.
Okay.
Literally within 2 hours. Take out all the remaining teeth that are failing. We do not give them a denture, place the dental implants. We put a full arch of new teeth in. They're walking out literally with new teeth that day.
Is that right?
Absolutely. In fact, you know the number one thing that patients say when they come back to me? They say, I should have done this earlier. I had no idea that this was an option. I thought I was going to go to a denture, and that's just not true.
But if you have gum disease, periodontal disease, are like bad gums, right? Are the implants more likely to fall out or have a problem?
No, they're not. In fact, those are the best patients to do this treatment for. Why? Because the bacteria that are actually causing the periodontal disease, causing the bleeding gums, causing all the problems, causing the teeth to become loose and fall out, are attached to the root surfaces. So if we actually take out the teeth, we remove the root surfaces, we remove the bacteria that are causing the problems, remove the periodontal disease, right? So we're able to clean up everything in one procedure, place the dental implants, the gums now heal because now the bacteria and the root surfaces that are hosting the bacteria are now cleaned up. The infection goes away, the gums actually heal and become healthier, they become more viable, you don't have bleeding gums anymore. So actually, on the contrary, these patients are the prime candidates for this type of procedure.
So this bacterial infection, okay, so once that's gone, did the patients feel healthier?
Absolutely.
And are they healthier?
Absolutely. Imagine yourself every day eating something and your mouth is always bleeding because you have unhealthy gums, or that you're always in pain because your teeth are moving, because your gums are hurting, they're infected, they're throbbing, right? So we clean up all this mess, give them their implants. Now they can eat whatever they want. They don't have pain when they eat. They don't have bleeding every time they eat some food. So actually we make them healthier and relieve pain.